Ready to gain confidence for the NCLEX? Tackle another 10 tricky practice NCLEX questions and answers. Perfect for both new and experienced students, these questions are sneaky and easy to get wrong, especially under pressure. Let's conquer these tricky NCLEX questions together. Question 1. Nurse Kayla is reviewing the laboratory results of a patient with cirrhosis, which result indicates that the patient's condition is worsening. A. Decreased serum ammonia. B. Increased serum ammonia. C. Decreased serum creatinine. D. Increased serum creatinine. And the correct answer is B. Increased serum ammonia. Rationale. An increase in serum ammonia levels indicates that the patient diagnosed with cirrhosis is worsening, so C, decreased serum creatinine, should be eliminated. Decreased serum creatinine indicates improvement with renal impairment. Increased serum creatinine is related to renal impairment. Question 2. Nurse Logan is listening to a 50-year-old patient who stated, "Will I add any value to the world?" According to Erickson's stage of growth and development, the patient's statement is associated with which of the following? A. Generativity versus stagnation. B. Initiative versus guilt. C. Autonomy versus shame and doubt. Or D. Trust versus mistrust. And the correct answer is A. Generativity versus stagnation. Rationale. Generativity is based on making a positive impact and giving back to the world. This can be through meaningful work or raising children. Stagnation is feeling a lack of purpose. The hint is also noted in the patient's age. This stage usually affects those that are aged 40 to 65 years. Trust versus mistrust is normally seen in infants to 18 months. Autonomy versus shame and doubt is the second stage that is seen until 3 years old. Initiative versus guilt is seen in those aged 3 to 5 years old. Okay, on to question 3. Nurse Anna is monitoring a patient that is using bronchodilators. Which of the following common side effects should Nurse Anna observe for? A. Bradycardia. B. Tinnitus. C. Bradypnea. Or D. Tachypnea. And the correct answer is D. Tachycardia. Rationale. Tachycardia is a common side effect of bronchodilator, so A. Bradycardia can automatically be eliminated. Tinnitus and bradypnea are not common side effects of bronchodilators. Other side effects that may be reported include headaches, nervous tension, muscle cramps, and trembling. Question 4. Nurse Justin is providing care for a patient with end-stage renal disease who received a kidney transplant 4 days ago. Which of the following signs should Nurse Justin monitor as an early sign of transplant rejection? A. Redness at the incision site. B. Increased urinary output. C. Weight loss. Or D. Decreased urinary output. And the correct answer is D. Decreased urinary output. Rationale. An early sign of transplant rejection is decreased urinary output, so B. Increased urinary output can be eliminated. Weight gain is usually expected, not weight loss. Redness at the incision site is normal several days after a surgical procedure, but infection signs at the incision site should be reported immediately. Question 5. Which of the following findings is expected in a patient diagnosed with right-sided heart failure? A. S3 heart sounds. B. Lung crackles. C. Dyspnea. Or D. Peripheral edema. And the correct answer is D. Peripheral edema. Rationale. First, know the difference between right-sided heart failure and left-sided heart failure. In right-sided heart failure, the right side of the heart is not pumping blood to the lungs efficiently. Signs and symptoms occur due to backup of blood in the venous system. Peripheral edema occurs as a result of fluid buildup due to poor blood circulation. With left-sided heart failure, the heart is unable to pump blood out to the systemic circulation efficiently, resulting in fluid buildup in the lungs. S3 heart crackle, lung crackle, and dyspnea are signs and symptoms of left-sided heart failure. Okay, we've reached the halfway point. Take a moment to take a deep breath. Every like, comment, and subscribe greatly supports more videos like this where we break down the hardest NCLEX question. Make sure to subscribe if you haven't already and share this video with your fellow aspiring nurses. Ready to tackle the second half? Let's jump right back in. Question 6. Nurse Anna is providing education to a patient diagnosed with Raynaud's disease. Which of the following statement indicates that the patient has an understanding of Raynaud's disease? A. I will avoid exposure to the cold air. B. I will avoid a high potassium diet. C. I should remain on bed rest. Or D. I should use a cane for ambulatory support. And the correct answer is A. I will avoid exposure to the cold air. Rationale. To answer this question, one must know what Raynaud's disease is, which is a condition that affects the blood flow to parts of the body. The fingers and toes are commonly affected. The blood vessels constrict in response to stress, such as the cold, so a temporary decrease in blood flow occurs. The patient should be educated on avoiding exposure to a cold environment, avoiding a high potassium diet, remaining on bed rest, and using a cane will not affect the patient's blood flow. Question 7. Nurse Jackie is providing care for a child with ventriculoperitoneal shunt. Which of the following signs and symptoms indicate that the ventriculoperitoneal shunt is failing? A. Abdominal distension. B. Decreased blood pressure. C. Increased urinary output. Or D. Projectile vomiting. And the correct answer is D. Projectile vomiting. Let's go over the rationale. Ventriculoperitoneal shunt is implanted to treat hydrocephalus. Excess cerebrospinal fluid is getting diverted from the brain's ventricle to the peritoneal cavity. Projectile vomiting is a sign of increased intracranial pressure, which indicates failure of a ventriculoperitoneal shunt. Decreased blood pressure, abdominal distension, and increased urinary output would not indicate failure. Question 8. Nurse Ben is providing education on insulin-dependent diabetes management. Which of the following statement indicates that the patient has an understanding of the signs and symptoms of hypoglycemia? A. I should report if my blood glucose level falls below 130. B. Tremors and sweating are signs and symptoms of hypoglycemia. C. Diabetic ketoacidosis is a result of hypoglycemia. Or D. Early signs of hypoglycemia include increased thirst and fruity smelling breath. The correct answer is tremors and sweating are signs and symptoms of hypoglycemia. Let's go over the rationale. Hypoglycemia is a complication for those with diabetes, so the patient should be educated on what to look out for. Tremors and sweating are signs and symptoms of hypoglycemia. Hypoglycemia typically occurs when the blood glucose level falls below 70, so A can be eliminated. Diabetic ketoacidosis would be related to hyperglycemia, not hypoglycemia. Increased thirst is an early sign of hyperglycemia, and fruity smelling breath is a late sign of hyperglycemia, so D can be eliminated. Question 9. Nurse Jean is providing education to a nursing student on the difference between presumption signs and probable signs of pregnancy. Which of the following is a probable sign of pregnancy? A. Hagar sign. B. Amenorrhea. C. Breast sensitivity. Or D. Weight gain. And the correct answer is A. Hagar sign. Let's go over the rationale. Hagar's sign is the probable sign of pregnancy, which is the softening of the cervix. This may appear between week 6 and 12. Amenorrhea is the absence of menstruation, which is the presumptive sign. Breast sensitivity and weight gains are also presumptive signs of pregnancy. Presumptive signs of pregnancy are subjective signs of pregnancy. Probable signs are more conclusive, but still not entirely definite signs of pregnancy. Okay, final question. Question 10. Nurse Perlina is providing care for a patient who states that she is pregnant. Which of the following are definite and positive signs of pregnancy? Select all that applies. A. Fetal heart tones. B. Leopold's maneuver. C. Ultrasound. Or D. Amenorrhea. And the correct answer is A, B, and C. Fetal heart tone, Leopold's maneuver, and ultrasound. Let's go over the rationale. Fetal heart tones can be detected as early as 5 to 6 weeks after conception through an ultrasound. A and C can be selected. Leopold's maneuver is a way to determine the fetus position inside the uterus, which is a definitive and positive sign of pregnancy. Amenorrhea is the absence of menstruation, which is a presumptive sign, so D can be eliminated. Great work on the 10 tricky NCLEX questions and answers. If you manage to get more than 5 correct, you're well on your way. If not, hit that replay button and get yourself comfortable with my rationale. That's what I'm here for. Looking for more tips and tricks to make your journey even more fun and engaging? Check out my next video where we dive into more essential nursing school hacks. Thanks for dropping in and see you in the next video.